Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752. And the website to take a look at Dr. Darrow actually doing the treatments on video is www.jointrehab.com. That's jointrehab.com. And right now we are speaking with Mike in Los Angeles.
Hey, Mike. Marc Darrow again. I'm the guy who does the regenerative medicine with PRP and stem cells. I've been doing regenerative medicine, it used to be called prolotherapy, for over 25 years since my residency training at UCLA. And don't get mad at me if you're a USC fan, because I went there also. I got a master's of tax at USC. I was a lawyer before that. I've been around the block. But anyway, medicine is my real love, and I enjoy all of this. I enjoy talking to patients like Mike here, who's got a shoulder problem, and Mike's had a problem for the last couple of months with his right shoulder. He doesn't know how it happened, and I was explaining that the body has these little tweaks, strains and sprains all the time. We probably have a little one every day, at least one, and they go away. We don't pay attention to them. You get a little crick in your neck or something, but some of them last. And I've had people actually come in with what we call an enthesopathy, is where the muscles, ligaments, tendons attach to bone. And he had 50 years of low back pain. And I did one injection on him, and that cleared it up. My body has always healed quickly. Some people take longer. They take more treatments. Don't think of this as a miracle. It really is not. People call it a miracle because it works so effectively. It's not going to work on everybody. You've got to pick the right patient, and you've got to know what you're doing. And for most body parts, you have to use the ultrasound, which Dr. Grove, Thomas Grove, you can look him up on my website, www.jointrehab.com, is doing all the injections now. My hands are overused. I've been doing this for over 25 years. I have to save them for a little golf, right, Nita?
Absolutely. How about a lot of golf?
Well, it gets boring after a while. I like medicine better. But anyway, back to what we were talking about, Mike. If you get an MRI, if your shoulder continues to bother you, happen to talk to a doctor, and he says, let's get an MRI, see what's wrong. Don't get overly enthused about what is found, because it may have nothing to do with where your pain is coming from. How do I know that? There's studies on it. We're going to send you out a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's got the foreword by Suzanne Summers, and in it there's 258 studies about how regenerative medicine, platelets, and stem cells work, how surgery is failing us now, and how images do not tell us where pain comes from. So the common thing, and this is what happened to me, is I had an MRI, and this is a long time ago. This is like 30 years ago. I had an MRI in my right shoulder, which I hurt weightlifting, and it showed what was called impingement syndrome. Had a surgery, and then my shoulder got really bad after the surgery for about 4 years until I learned how to inject it myself, and it healed overnight. So it's a great story. I have a great life. What guided me to do this? It's magical to me. I was lucky that I had the shoulder surgery to learn that surgeries are not the answer. Can they be the answer? Of course. There are times when you have to have a surgery. If you the example I like to give is if you break a bone and it's sticking out of your skin, you better get right to the ER and have an orthopedic surgeon put you back together. But most of the stuff I see shouldn't be operated on. I have way too many people who come in after a surgery that failed them. They got worse. And I'm very cautious. I love the surgeons. I always say this. When I say I don't like the surgeries, that has nothing to do with the surgeons. I love the surgeons because they're the bravest guys in medicine to go in there, cut the body open. And I don't understand how they can keep doing these meniscal tears and rotator cuff tears because there's way too many failures with that. And I don't know why they're not learning about how to do PRP and stem cells. I know they try it a little bit here and there, but it's not the kind of thing you can try. It's the kind of thing you have to persist at, and you may need more than 1 or 2 treatments to fix an area. So getting back to your shoulder, Mike, we don't know what's going on until I touch the shoulder. Okay, I have to examine people to know where to inject. And if you do happen to get talked into an MRI and they tell you that you have a rotator cuff tear or a labral tear or whatever they find, don't get all jacked up and nervous about that and jump into a surgery, because I have 0 pain in my shoulders, and my right shoulder has 2 rotator cuff tears. My subscapularis tendon has a tear, and my supraspinatus tendon has a tear. And around the shoulder, around the, in the glenoid, which is the shoulder joint, the labrum lives there. Labrum means lip in Latin. It's like putting a lip around a doorknob to hold the doorknob, so it holds the humerus bone, the arm bone, into the joint. And mine is torn. So I've injected all that stuff. I've injected my tears, and pain went away. So is there still tears there? I'm sure there is. Does it bother me? No. So way too many surgeries are done because of MRIs that show things that are not the problem. Mike, does that make any sense to you?
Mike, are you there?
He fell asleep with my droning. It reminds me, when I was an attorney one time, I was in a trial, and the judge was, I'll use the word beyond elderly. I don't even know why he was on the bench. And he kept falling asleep when I was discussing the case. And
oh, my goodness.
I had to keep yelling my closing argument to wake him up to listen. I felt bad for the guy. I guess it was time for his nap.
Oh, my goodness.
Yeah, law is a very strange thing, just like medicine is a strange thing. Anyway, Mike, there's good hope for healing your shoulder just by doing stretching exercises. We show people how to stretch the shoulder. We do a little home physical therapy, home PT we call it, for them. We teach them how to do that. And sometimes all it takes is just stretching out the shoulder to get rid of the pain, regardless of what the pathology is. The pathology, which means what does it show, doesn't necessarily mean anything at all. Okay. Nita, are you breathing again?
No, not really. I tried to avoid that at all costs. It's just like a waste of time.
You've gone alien on me, huh?
Well,
is Mike back on the phone?
Just to make it interesting.
I'm looking at our call screen.
Okay,
it's
let's
blinking yellow, and it has Mike's name up there.
Well, let's see if Mike came back. Mike,
are you back? Are you there?
Yeah, I'm here.
Okay. Did you happen to hear what I just said?
Partly.
Okay. Do you have any questions left over from our discussion here?
Yeah, I do. One other question.
Sure.
On my right side also, not sure it has anything related to the shoulder, but
sure.
I went, this was like last year, I went to pick up something, and my right thumb just went back on its own, almost
sure.
like it was, it felt like it was like breaking on me.
Well, what does that mean? It felt like it was breaking, but it didn't break.
So
did it bend the wrong way?
Yeah, it bent back the wrong way.
Okay.
So it was quite painful, but anyway, I pushed my thumb back.
Sure.
I still have pain in my on that side, on my right side with the thumb, but I can still pick up stuff now. But before, I wasn't able to do anything because it was that painful.
Okay.
I'm not
so
sure
this is a great example. I can make up stories about what it might be, But that's not necessarily what it is. I have to touch the area, see where the pain is or was, and then I can tell you in a heartbeat if it was coming from maybe a joint subluxation where the joint didn't dislocate, but it just moved a touch and you popped it back, or it could have been a tendon or ligament or something like that. So if it still bothers you, while we're injecting your shoulder, I'll throw your thumb in for free.
Okay.
So yeah, I'm not worried about anything you have. If you want to see a doctor, you should do that. I always like second opinions, but don't get sucked into getting a surgery for the stuff you have.
Well, first thing came to mind was you, to come and see you.
Well, the phone number to the office, you can call there right now, is 800-300-9300. There's people by the phone. And I say this on every show, and my staff said don't say it anymore, but I'm going to say it again. If you call the staff, you get a free phone consult with the staff. Not with me, not with Dr. Grove. You just get to talk to them on the phone. They know a lot about this stuff, and there's a lot of things that we don't necessarily cover on the show that they can answer for you. So you're not going to get a chance on the phone to talk to me or Dr. Grove, but you can talk to my staff, and they know most of this stuff too. Sound fair?
Oh, okay.
And the phone number to the office is 800-300-9300. And for those of you that want to watch me do these videos, go to the website. There's a lot of videos on there, www.jointrehab.com. You could also go to YouTube, youtube.com, and just type in Marc Darrow, MarcDarrow, MD, and there's a ton of videos on there that you can watch too. So I want to mention something else. Mike, first of all, are we pretty much done with you?
Can I get one of your books?
Oh, yeah, we're going to send it out to you. Yeah, it's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. We're going to call you up after the show, get your address, and mail you out a book. And I'm going to pay for the postage, okay?
Okay, thank you. Thank you.
God bless, man. I really appreciate you calling. You're a good guy.
Thank you.
So
thank you.
Thank you, Mike.
I just wanted to mention, Nita, there's some other things we do in the office.
Yes.
Orthopedics, you might say, is the mainstay, but we also use regenerative medicine on the face. It's called the vampire facelift, and on the top of the head to regenerate the hair follicles if people's hair is thinning out. If you're completely bald, don't waste your time. But it's not going to work. You get some hair growth, but not enough to make you happy. But if it's thinning, it's really a great procedure. And also, I'm starting to do what we call sexual health. And for those of you that are having issues with libido, erection dysfunction, things like that, we can actually inject these cells into the penis. And very simple procedure. It takes a minute to do it. It's a very thin gauge needle. And that can help with erection dysfunction and sensitivity and all of that. So that's something newer that I'm getting into. And it's interesting. I've always done hormone therapy, hormone rejuvenation, you may call it, with testosterone for men and estrogen, progesterone, and estrogen, progesterone. What's the third one? I'm blocking. I'm so crazy. Estrogen, progesterone. Yeah, estrogen, progesterone, testosterone. That's the three. Women don't get injected. We use creams. That's so that the medicine is actually ingested by the body transdermally. That means through the skin. So I like to put estrogen on the neck where the jugular vein and the carotid arteries are, because you get a faster uptake and a more complete uptake. A lot of women put this on their tummy or on their wrists or other places, on their back, but they're not going to get the same absorption as where these big blood vessels are. The testosterone I like to put, I'll say where it counts to wake up that area for women who are losing their sex drive. And progesterone I like to give by mouth right before sleep, because it converts to allopregnenolone, which actually helps you sleep. And a lot of women, when they go through menopause, they have problems sleeping. So it's an area that I haven't done for a while, but I'm getting back into it if that's something that you like. And these hormones are great after menopause, or with men it's andropause. People start losing their hormones at around the late 20s. And then men are talking about erection dysfunction in their 40s and 50s and much worse later. And so these hormones bring you back to a very youthful state. And it increases muscle tone, burns fat. It actually wakes up the brain. I've had women who I've put on estrogen and progesterone, testosterone, who call me up and they go, I can't believe my memory has come back. I'm sleeping better and all of that. So it's a lot of fun to do this kind of work. And if you're interested in that, you can call the office and get more information. So what else should we talk about? We've got a couple of minutes left. Let me give out the phone number to the studio. It's 866-870-5752. That's 866-870-5752. And by the way, that shot I was talking about that men get is called the P shot. And it was trademarked by a doc in Arkansas named Charles Reynolds. He teaches the P shot, the O shot for women, and all kinds of other areas of the body using PRP or PRP and stem cells. So it's interesting. It's very interesting to be able to help people feel better. And that's really, to me, what medicine is all about. So, Nita, if you don't mind.
Yes. You want to take a question?
Well, you would like me to, because you don't want me to ask you a joke.
Oh, I totally forgot about jokes. I really did.
Nita,
I was just thinking, the audience likes to hear.
You're distracting. What did one plate say to the other?
Move over before I break you.
That sounds good. I'm going to give you 25% of a point.
Oh,
dinner
great.
Dinner is on me.
Ha! That's a good one.
One more, Nita.
Okay.
Why do hummingbirds hum?
Why do they what?
Hum.
Oh, why do they hum?
Why do hummingbirds hum?
So they don't lose their directional focus when they're flying.
Well, that's maybe true. I don't know why they hum, because I guess because their wings go so quick.
Oh,
right?
Look, it's Maria in Anaheim.
Because they don't know the words.
Oh, got it. Okay, let's go to Maria in Anaheim.
Maria in Anaheim, Dr. Marc Darrow. You just saved Nita's life.
I was calling regarding to my neck. I'm beginning to get a turkey's neck, and I was thinking about doing the thermage that would tighten it, but I'm thinking maybe that won't help because I'm 62 years old, and maybe, I don't know, do you have an injection that would do it, or no, it would be a miracle?
Well, there are people that do that. They do PRP on their neck for that issue.
They
so
do
yes,
what?
they use platelets from their blood. We take the blood, and then we spin it in a centrifuge. We throw away the red cells. We use the platelets, and you would have to call the office to find out more about that. On the face, we call it the vampire facelift. Okay.
Okay.
And the phone number to the office. Do you have a pencil?
Okay, wait. Hold on. Let me get a
I
pen.
am. I'm with you. I am there.
And let me pull over too, where I can write it down. Hold on.
Smart.
And let me ask you too. You said about the hair too. You do something because my hair is thinning on top.
Yeah. Well, we could take a look at you and see if we can help you or not.
Okay.
The phone number
really
to the office. Yeah, hang on. We're getting to the end of the show. We have other callers. The phone number to the office, because you'll need to call them, is 800-300-9300. You can call them right now while you're 800-300.
300. Wait, you're coming in at 800-300.
9300.
Yeah, 800-300-9300.
Okay, because I'm in an area where I got all hills around me. Okay?
Okay.
And that's why I get a bad connection. Okay. Thank you so much.
God
Thank
bless
you,
you, Maria.
Marie.
I appreciate you calling up, and we have Jeff waiting on the studio line here. Jeff, your back is bothering you. How long has it bothered you for?
Oh, it's been probably since 2010 or so.
Okay.
And
so you got about.
In a nutshell, I had an 8-millimeter bulge at L5, L4 into my spinal column, and I had sciatica.
Okay.
But most recently, the disc has actually gone down on MRI to a 2-millimeter bulge. But the concern now is I have something, and I may mispronounce it, spondylolisthesis.
Yes. So let me start talking. Let me start talking now, because I got a lot of information to talk about.
Okay.
To help you. So number one, spondylolisthesis generally means nothing. It means one vertebrae doesn't sit exactly on top of the other. So it sounds like you have a grade 1, minimal. Okay?
Yeah.
If you had a grade 4, your legs probably wouldn't be working, because the juice down there from the nerves would be cut off. All right? So I'm not worried about yours. So I'm not telling you it's not a problem, but just from what you told me, it's not a problem. Are you having sciatica right this second?
Yes, I ended up. Now I'm sitting, so it's not a real concern.
I heard that as a very equivocal. No, I really am not having it now. So the disc bulge.
It depends on what I'm doing. If I try to,
I hear you.
Yeah.
So my turn, Jeff. My turn. Okay. I got information for you, and the show is almost over. You're going to lose it unless you let me talk. So the disc bulges generally mean nothing. Okay? Most people, as they age, their discs start to break down. They either dry out, they can bulge, whatever it is, and it doesn't cause them pain. Don't get snookered into a back surgery because you have a disc bulge. Okay? You need a doctor to touch your back and find out where this is coming from. The entire issue you have may be what we call an enthesopathy, where the ligaments in the back attaching to the pelvis are creating your pain, like a sprained ligament somewhere, a sprained tendon somewhere, anywhere else in the body. When it gets into the back, it gets very sexy, and doctors want to cut on it when they shouldn't. Jeff, you know what? Call the office now, 800-300-9300. Get in to see me, and I need to touch your back and find out what's going on. I don't think you're having a big problem, but who knows? I'm not telling you on the radio. I'm not your doctor. If I touch it, I can tell you in a couple seconds what is happening. God bless you, Jeff. I appreciate your call. Thank you, Nita and Alex and Suzette and the rest of the staff.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his joint rehab and sports medical center experts for free, and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.